So it is incumbent upon us to make sure that we employ the right products to take that wound of chronicity to get it to a point of resolution. We need to do that quickly. Our products do that quickly, do it efficiently, and do it with every single type of etiology that you could think of. And I'm going to show you some etiologies that we're going to be successful with in treating wounds. Okay, I want to talk about diabetes. Diabetes is a pandemic problem. I know diabetic incidence in Malaysia is increasing. I know it for a fact in the United States. It's increasing, and through certain pockets. When I went to Saudi Arabia to lecture to the doctors and nurses in Saudi Arabia, their incidence of diabetes is 25%. Amazing. Amazing. One of the highest incidences in the United States, in the world. One of the highest incidences. So here's what happens. We see that everything goes wrong in a patient who has diabetes, because diabetes has a very serious metabolic consequence on the body. We do not have proper we don't have proper cellular function. We have everything's decreased, deficient, abnormal. This is phase 1. So instead of having a short phase 1, which is inflammatory, we have a longer phase. It's sustained. Instead of having an efficient phase 2, where we're going to migrate and proliferate cells, we have a deficient function. We have a deficient cellular response. And phase 3, we have problems with wound remodeling and wound contraction. Let me go over with you very simply what diabetes does. We know it's a preponderance of glucose in the system. And it affects many organ systems. The eyes, the brain, the heart, the kidneys, the liver, the nervous system. Let me tell you about the nervous system, because this is related to a slide I'm going to have on neuropathic lesions. Glucose comes into the body. Glucose is the energy source for the cell. In order for the cell to use the energy, it needs to get in the cell. But it can only do so under the permission of insulin. So insulin is the key to the lock of that door to open up, to let glucose in that cell. But if there's no insulin, or a patient is insulin deficient, the glucose just hangs outside the cell, and it has nothing efficient or good to do. So it gets into the nerves. When it gets into the nerve, it swells. After some time, it shrinks, and that nerve scars. So when you're trying to have an electrical transmission from node of Ranvier down to node of Ranvier, it's not efficient. It doesn't go down that nerve properly. It offshoots in different areas because it's traveling on scar tissue. That's why patients who have nerve problems, diabetic neuropathy, have paresthesias, tingling, numbness. So now you know the pathophysiology of your patients who have peripheral neuropathy. That's the pathogenesis of peripheral neuropathy. We need to heal these wounds, because if not, the patients end up in a condition known as amputation. Amputation affects a lot of aspects of life, and it's not good quality for the patient. So we see here, diabetes and wound healing, they don't go together. So we have to control the diabetes, be sensitive to the patient who is chronic diabetic, and also try to facilitate the wound healing. We will show you some beautiful cases done here in Malaysia, I believe Kuala Lumpur. of patients with diabetic foot ulcers on how we're able to heal them in a very impressive time period. That's the second part of my presentation. So I spend a little extra time on this slide because I really want to impress upon you all what happens in diabetes. Why is the body not responding the right way? Why is diabetes such a deleterious insult? It's a very chronic metabolic problem. And here's some statistics. I go to this one here. Americans have the highest levels of obesity. That's my contribution to the world. No, not me personally. But my citizens from the United States, we just need to control diet. 26% out of 300 and some odd million Americans, that's a lot. And of course, I commend you all. Southeast Asia has the lowest level of obesity, 3%. Okay, fine, but you still have diabetes on the rise. Okay, so you have genetic preponderance of diabetes as well as dietary influences. You have to be careful of this. All right, so I put these statistics here. 1 in 3 adults worldwide has raised blood pressure. So you look at the whole constellation of the comorbid conditions, and we see that diabetes is not a good thing for wound management. And it's not a good thing for other body functions. It's not a good thing for other systems in the body. Okay? All right, so let's talk about some conditions that may give rise to a wound. And here's what I just mentioned. Diabetic or neuropathic wounds. We see here that these wounds are in a crater. They have a very callous peri-wound condition, and they're usually on the bottom of the foot. So I just told you the pathogenesis. Here's how that happens. These patients with one little small speck of sand in their shoe, they cannot feel that speck of sand. So that speck of sand continues to annoy and aggravate and erode that tissue. They only know when they have a problem when it gets to this level. Because in diabetes, the body cannot produce collagen efficiently to heal this wound. But I'm happy to tell you that we have great products to put into this wound to heal these wounds. You see? So you have a problem here, we have solutions. Problem, solution. As we have been trained in medicine and nursing, you have a problem, you better come up with a solution. Am I correct? Yes. Thank you. Correct. Thank you for that. Okay, so diabetic wounds take a long time to heal. No more. Our products heal them in a very impressive time period. Very impressive. Venous stasis ulcers. We see here venous stasis. What is the pathology here? Is that you have incompetent veins in the lower extremity. And if you have an incompetent vein, you have a dependent pooling of blood. And the dependent pooling of blood stays in the lower extremities because gravity is not our friend. Gravity is not our friend. And if a patient with venous stasis, because of an incompetent valve, gets a puncture, they end up with this type of wound. When you use our collagen product on this wound, and you do a compression wrap, you can leave our product in there up to 7 days. And we're able to turn the tide of this case to a point of resolution. These usually occur on the medial surface of the lower extremity, and they're painful. And I'm going to just tell you now, if you're taking notes, please write these 3 things down. All of our products give you the first top 3. Granulation tissue, reduction of wound pain, and I'll tell you why later, and minimize the potential for scarring. That's not bad for the top 3 from one product. All of our products have those inherent wonderful properties. Granulation tissue, reduction of pain, and minimizing the potential for scarring. Now what about arterial insufficiency? These usually occur on the lateral aspect, and the pathology here It's not a valvular problem. It's a condition called